Dr. Shi Armero, your friendly OBGYN and lifestyle medicine specialist, and you are watching Shi TV. Welcome back to my channel, loves. Thank you for always supporting me by subscribing and liking my posts and videos. If you are not a supporter yet, click the subscribe button below and turn on the notification bell for you to be notified on future videos.
DANGPANAN, kabahin sa panglawas o relasyon. Shi Armero.
Hello, this afternoon we will be learning something very important, not just among those non-pregnant, but also among those who are pregnant who are in previous cesarean section. Let me share my screen. Welcome back to my channel. I am Dr. Maria Shi Armero, and today we will be discussing about previous cesarean section, its myth or fact. Is it a myth or fact? Once a CS, always a CS. Hi, I am Dr. Shi Armero, and you are watching Shi TV, your way of life. Today, we are going to answer frequently asked questions on previous cesarean section. Doc, may chance pa kaya akong maka-normal? Or in other words, technically speaking, do you have a chance to do a trial of labor after cesarean section? In short, TOLAC. Before I answer your question, let me ask you back. Bakit ka nga ba na CS? What was the reason why na CS ka? So I have listed here reasons and indications to do cesarean section. Number 1, cephalopelvic disproportion or dystocia. Doktora, hindi ko maintindihan, masyadong medical. Or in other words, masyadong malaki si baby para makadaan sa puwerta. Or masyadong tight o masyadong maliit, masikip yung puwerta. Number 2, presentation. Kung breech si baby, kung transverse lie si baby, yon. Hindi yun pwedeng maka-normal kung kaya't na cesarean section ka. Third, fetal distress. Yung heartbeat ni baby, hindi maganda during labor. Or others used to tell me, Doc, nag-cord coil. Because the cord coiling is usually presented as fetal distress. Or yung heartbeat ni baby bumababa. Kaya't hindi ka nakapag-normal at na cesarean section ka. Maternal complications, pwede ding because of severe hypertension at kahit anong gawin nila para maka-deliver ka vaginally at hindi ka nag-respond at hindi na maganda yung status ni mommy or status mo, kaya't na cesarean section ka. Pwede ding yung placenta mo nauna. So hindi ka din pwedeng maka-vaginal delivery kung kaya't na cesarean section ka. So those are just a few of the indications. Again, masyadong malaki si baby, hindi yung ulo yung nauna, hindi maganda yung heartbeat, or may maternal complications such as hypertension, o di kaya't yung placenta niya or ang placenta ay hindi located high-lying, naka-placenta previa. Tanong, Dok, sakit na kaayo, ECS na ko. Or in Tagalog, Doktora, masyadong na masakit, pwede bang cesarean section mo na ako? Is this an indication para ma-cesarean section ka? Ang sagot, hindi. Hindi indication ang masyadong masakit na labor para i-cesarean section ka. Hindi pwedeng ganun. Ang labor, masakit talaga yon. So, dapat paghandaan na natin ang ating sarili na oo, masakit ang labor at hindi ako isi-CS ni Dr. Armero dahil lang sabi ko sa kanya masakit na masyado. Okay? So, sino nga ba ang pwede maka-normal or maka-trial of labor after cesarean section? Sabihin natin trial kasi hindi pa sure kung ikaw nga ba talaga ay makapag-normal delivery. Okay, so ito ay factors that influence successful trial of labor after cesarean section. Konti lang ito, so mabilis mong matandaan. Number 1, transverse uterine incision. Huwag mong tingnan ang tiyan mo. Hindi siya uterus ang tiyan. Okay? Yung anterior abdomen, hindi siya yung titingnan natin. Kasi may iba naka-bikini cut, may iba naman naka-midline. Yung titingnan natin is the uterine incision. Yun yung nasa loob. Okay? So, paano natin malalaman kung what type of incision do we have? It's written in your operative record, yung papel na galing sa ospital, kung saan ka na CS, doon nakalagay kung anong klaseng incision na meron ka. Kung ang incision mo sa uterus ay transverse, nakaganon. So there is higher chance of success for trial of labor after cesarean section. Second, kung naka-vaginal delivery ka na previously, so mas higher ang chance mo na maka-vaginal delivery ka ulit kahit nagka-1 cesarean section ka na. Third, nag-labor ka spontaneously. So pag ganun, wala na kaming magagawa at mag-deliver na tayo vaginally. And lastly, non-recurring indication, di ba na intro ko na yung common indications for cesarean section. Pag yun paulit-ulit, chances of success low. Pag hindi na naulit yung indication na yon, so higher chance na maging successful ang trial of labor after cesarean section. Example, Doktora, ang previous indication ko, hindi maganda yung heartbeat ni baby. Hopefully this time, pag okay yung heartbeat ni baby, makakapag-tolak tayo. Pero kung nagka-disproportion or nagka-dystocia, cephalopelvic disproportion, kasi masyadong malaki si baby at masyadong maliit yung dadaanan, hindi na yan ma-change. Yung dadaanan, ganun pa din yun. Hindi na yun maiiba kahit ilang beses ka pang magbuntis. So, pag yun ang indication mo sa first cesarean section mo, ang chances, ganun, low. Because hindi na siya mag-change. Yung anatomy mo, hindi na mag-change. It will not change. Okay? How about factors that influence failure of TOLA? So, tignan mo kung meron ka nito. Pag meron ka nito, higher chance na hindi maging successful ang trial of labor after cesarean section. Number 1, si baby masyado nang malaki. Is too big. Okay? That's number 1. Makikita mo yan. O yung tiyan mo masyado nang malaki. O you will know already. Number 2, pag si mami medyo malaki. According to studies, the higher the BMI, the lesser chance of success. O kung breech, o syempre, CS ka na nga sa first because of malpresentation, o nag-recur, malpresentation pa din, breech pa din. So, failure is higher. O twins. Pag twins, yung current pregnancy mo ngayon, lalo, the chance of failure is higher. Ito naman. Nag-decide ka na, gustong-gusto kong mag-tolak do. Hang nag-40 weeks ka na, hindi ka pa din nag-labor. So, the chances of failure too high. So, pag 40 weeks, diba, due date mo na yon at hindi ka pa din nag-labor. So, it's a sign na mag-fail ang tulak mo. Number 6, classical incision. Ito yung incision na opposite nung transverse. Si classical pag ganun. Pero again, sa uterus, wag sa tiyan, wag sa tummy. Hindi sa tummy titignan yung incision. Si classical incision is the incision you do in the uterus. Short inter-delivery interval, meaning nung nanganak ka sa itong CS mo, yung bagong CS mo, to panganganak sa bagong itong pinagbubuntis mo is short. According to studies, if less than 6 months, the higher chance of failure. Or may 18 months naman. So pag higher the inter-delivery interval, meaning yung gap ng pregnancy mo, more success. But pag masyadong close to each other, the lesser success of tulak. Okay? Okay. Pag may obstetrical contraindication sa present pregnancy mo ngayon, placenta previa pa, o sige, kuwari, breach in the previous, kaya ka na CS. Tapos ngayon, nung pregnancy mo ngayon, gusto mo magtulak, pero nung nag-ultrasound, placenta previa. So, hindi yun pwede. Kasi obstetric contraindication yun. Okay? And lastly, pag ikaw ayaw mong mag-trial of labor, syempre, hindi ka namin pipilitin. Mag-repeat cesarean section tayo or elective repeat cesarean delivery, ERCD. Now, next question. Ano ang mga komplikasyon kung ikaw ay previous cesarean section? At anong pwedeng gawin upang ito'y maiwasan? So I have listed here the common complications and comparing trial of labor and elective, yung sineschedule. Nag-schedule tayo ng repeat cesarean section. So let's see if may kaibahan ba with the complication, whether you choose TOLAC or trial of labor after cesarean or elective repeat cesarean section yung naka-schedule. Uterine rupture, the same. Pareho sila. Now, yung uterine rupture, yung pumuputok yung matres. Okay? Yun, may chance. Pero maliit lang. Blood transfusion. Sa tulak, meron, but questionable. Meaning, pag naging successful tulak ka, pag naging successful tulak ka, chances of blood transfusion, hindi naman ganon ka obvious o hindi ganon siya ka-always na nagta-transfuse talaga. While for elective repeat cesarean section, the chances high. Why? Because bleeding is more kasi nag-open ulit. Kasi hindi natin alam kung may mga adhesions dyan o hindi maganda yung previous na closure or healing ng wound mo on the first cesarean section. So, mag-bleed ka nga talaga. So, yun, blood transfusion becomes higher. Third is hysterectomy or yung tinatanggal yung matres because nga of uncontrolled bleeding. There is risk in TOLAC. However, there is higher risk in elective repeat cesarean section. Ibig sabihin, kahit saan sa kanila, there are really complications that you can see. But saan ba ang lesser? Saan ba ang safer for you? So, successful TOLAC, or if you become successful with your trial of labor after cesarean section, or we call it now, kasi di ba successful now, we call it now vaginal birth after cesarean. This translates to a lesser hospital cost and faster recovery time. Meaning, mas mabilis kang makakauwi sa bahay kasi nga, di ba ka, naging vaginal yung delivery mo. At of course, second, you will not pay for the anesthesiologist kasi hindi ka na-operahan, di ba? Yehey, na-vaginal ka. Now, pero, if nag-fail ang TOLAC mo, all these complications or all these risks increase fivefold. So, mag-multiply siya by fivefold. Mag-multiply 5 times. Because of that, kailangan nating i-weigh. And because of that, we need to communicate well with our obstetrician. Kasi they know better and they can guide us better. So, again, weigh your options. Know your complications. Ano bang factors na meron ka that can influence success? Ano bang factors na meron ka that can influence failure of trial of labor after cesarean section? So, anong solution? Ang hirap pagtimbangin, doktora. So, solution natin, avoid cesarean section in the prior pregnancy. As much as possible, huwag tayong magpa-cesarean section. Mag-push ka, mami. Pag almost, about to give birth na, control na your food para hindi masyadong malaki si baby. Mag-breathing exercises ka na para yung stamina mo maganda. Because may factors of 3 Ps. Passage, power, and passenger. Pag ang power ni mommy hindi masyadong maganda, na-affected ang labor. Pag ang passage masyadong masikip, of course, hindi magpo-progress yung labor. At third, pag ang passenger o yung dadaan, si baby masyadong malaki, of course, hindi din magpo-progress yung labor. So, i-address natin itong 3 Ps. Again, ano yon? Power, the mother, passage, yung dadaanan, at yung passenger o si baby. Now, doktora, na-CS na nga ako, anong kailangan kong paghandaan sa susunod na panganganak? Wala na doktora na-CS na talaga. So what are the things we need to prepare? So, number 1, get your operative record. Dun kung saan ka na cesarean, hingin mo yan sa medical records. Meron silang record niyan if wala ka niyan. If hindi nabigay sa'yo before ng discharge, hingin mo sa, anong tawag dito, medical record section. Meron sila niyan. Makikita mo doon anong incision mo, whether classical or transverse, bakit nga ba na CS, para pag mag-prenatal ka na, mapakita mo yan sa obstetrician mo. So start prenatal early kasi high risk ka because of your previous delivery. So you start your prenatal early. And so you plan ahead of the possibility or chance of vaginal birth after cesarean. So be honest with your obstetrician, Doktora. I really would want to deliver vaginal birth after cesarean. Can you help me weigh things for me para naman may direction yung pagplan namin of this current pregnancy? And very important ito, not just plan ahead with your obstetrician, you choose a hospital that can readily respond to emergency situation, meaning yung mga lying in, hindi na yun siya part of the choices natin because high risk ka nga. And besides, hindi ka rin nila tatanggapin pag high risk ka. So, you choose a hospital that can respond to emergency situation. Yung mga tertiary hospital na capable of cesarean section in case of emergency. Dapat may obstetrician in duty, may pediatrician na tatanggap kay baby. Kung wari, God forbid lang talaga may complications kay baby. At of course, hindi pwedeng magka-cesarean section na walang anesthesiologist. Kailangan may anesthesiologist. Number 5, revisit plan of delivery regularly. Kahit sabihin natin, gusto natin magtulak, trial of labor after cesarean. But as you go on with your prenatal, you revisit it regularly. Doktora, at this point ba, may chance pa din ba akong trial of labor after cesarean section? Because along the way of the prenatal, there are several factors that we also need to consider. And lastly, kung ikaw ay previous cesarean section, bago ka magbuntis ulit, you choose a fitting spacing method for you and for your partner after delivery. Kasi nga, one of the success factors is yung interdelivery interval na far from each other or yung long interdelivery intervals. It's important na hindi magkasunod masyado yung pregnancy mo, especially kung previous cesarean section ka. Okay. So, I hope may na-learn kayo. Before I end, let's answer the intro slide. Whether once a CS, always a CS. Hopefully, may sagot na lahat at tama. Okay? Is this a myth or a fact? It's a myth. It's a myth na once CS, always a CS. Kasi, di ba, may chance tayo na mag-vaginal through trial of labor after cesarean section. Only if ma-weigh natin yung options, makapagplano ahead. Because again, there are a lot of benefits if we become successful, if we have vaginal birth after cesarean section. So, once again, I am Dr. Shi Armero, and you are watching Shi TV, your way of life. if you believe that you have learned a lot in this video and wish for others to learn with you as well, don't forget to like, share, and subscribe in our channel, Shi TV. Bye! Hello, hello, hello! So before we move on and answer your questions, I will have to give an award first. Oh, for those who are able, or for those who will be able to answer the question. But I will really give a bonus because Krish Sia Montesilio, she really answered. Oh, nag-answer siya myth. Very confident, very good. It's a myth because, di ba, as I said, we have options for trial of labor after cesarean section. So, Prish, you message our page so you will get your, what you call this? Free online consultation coupon. Again, our free online consultation coupons are transferable. So, if you think that somebody else needs it more than you do, you can share it with them. You just let us know. Prish, thank you very much for answering. Let me greet our audience first. Hello, Christian Mato. I'm using my partner's account. Sino kaya ito? You chat again. Tell me your name so I can greet you. Hello, Ma. She's watching from Bohol. Hello to everyone from Bohol. Okay. There are also questions here already in the chat box. Don't worry, I will answer it later. We will first answer those who submitted their questions ahead of time, which we will present it also shortly. I will greet the audience first. Hello, Geneva. Thank you again for watching. I see Jenny. Jenny Campbell was also watching. Okay. Hi, Jenny is still with us. Thank you. Okay. All right. So let's go on and let's start answering the 10 questions muna. We have one winner already of our online consultation. Oh, yes. Okay. All right. Let's also give the other two first. Let's give the questions of the other two questions first. Then we will declare our winners before we answer the questions. All right, sige. Okay. Okay, quiz, give one indication of a cesarean section. Bakit nga ba na cesarean section ang isang mommy? Bakit ka na cesarean section? Anyone who can answer that? Hi, Karyang. Thank you for being with us this afternoon. O, sino makakasagot? The first one who can answer, give one indication. Bakit nag-cesarean section kay mommy? Okay. Ang galing! Nakaka-relate. Jen, nakarelate ka because Jen is a previous cesarean section. Very good. We have a second winner. Geneva Rose Rush is our second winner for the free online consultation. Okay. And I think we have a second question, no? Last for our free. Okay. Give one factor para maging successful in the trial of labor after cesarean section. Give one factor that can give us a successful trial of labor after cesarean section. Okay. Breachy baby, oh, that's a correct answer. You're the second winner already. Okay. Sige. What was the question again? Let's just show the second question. Okay. Give one factor to have a successful trial of labor. Paano ba? What are the factors? Or just give one factor to become successful. Very good. Nerds, hello. Thank you again for being with us. Spontaneous labor. Very good. So, ang galing. So, we have 3 winners already. Kindly message us so we can give you your 100% or your free online consultation coupon. Okay, thank you very much for participating. Now we will answer already the first 10 those questions that were given ahead of time. Okay, let's start. Question number 1. Doc, 4 years na po akong walang mens. But when I used iron pads, nagka-mens ulit ako. Mag 50 years old na ako this year, Doc. Is this normal? Okay. If you did not have menstruation for at least 12 months already, supposedly you are already diagnosed to be on menopause. So ibig sabihin, that means for the past 4 years, you passed through that stage already. And now that you are bleeding, whether or not you use the iron pads or what, if you're using the iron pads or not, bleeding after a year, 4 years of amenorrhea is something that we should investigate. So I'm suggesting that you visit an obstetrician, whichever you are comfortable with. You tell your obstetrician that I bled after 4 years of no bleeding. We should investigate things like this. Okay? Okay. Thank you. Next question. Hello po, Doctora. I wanna ask, if the age of 12, normal lang ba na minsan matagal datnan ng regla? My eldest po kasi pang second time niyang mag-skip. Okay. The number 1 question is, how old was she when she had her first menstruation? So if yung first menstruation or your menarche, usually say, example, at 10 years old. In the first 2 years kasi talagang medyo ganyan, irregular pa talaga. May iba talaga within the first 5 years, nagiging irregular pa. So my advice for you, you observe. If she reaches the age of 15, 16, 17, okay, 20, pag ganun pa din, you let her visit an obstetrician already. As long as she is not profusely bleeding, wala tayong emergency or urgent reason to correct. You observe muna. You watch her pattern of menstruation, and perhaps look at her build. Is she ano ba, medyo malaki? Is she overweight? If she is, then encourage her to exercise. You choose the healthier food, because you know the younger ones now, medyo hindi masyadong comfortable with yung mga plant-based whole food natin. Okay? So we as parents, it's our role also to encourage them to choose the right kinds of food para din to avoid yung mga hormonal na mga problems, because hormonal problem come from too high cholesterol, no? So if there is too high ano bang tawag dito, source, too high yung source of mother substance of our hormones, very high, natatranslate siya into hormonal imbalance. And so it can really help if you teach your children, not just your eldest daughter, all your kids, for a whole food plant-based diet. Okay, Doc, sorry to have bothered you. No problem. I have a simple question. I had an exploratory laparotomy. Okay, exploratory laparotomy surgery last 2018. Na-operahan siya, meaning na-open yung abdomen. So likely, midline yun kasi exploratory laparotomy. Is it okay to be pregnant this year? Is my wound fully healed? Yes! It will take, 6 months for our system to... Hindi my system. The organs, our tummy, everything to heal by 6 months. Of course, healing process will also get affected by number 1, nutrition, your healing process. Kung maganda yung healing process mo, of course, it's faster. But it's been, 18, nag-count pa talaga, 3 years. It's been 3 years already. Sure, you can get pregnant already. Yung surgery naman, hindi naman sa mattress. Okay, so hindi naman na hit na slice yung mattress. So walang injury sa mattress. So doon naman si baby magsistay sa sa uterus mo. So sure. Kaya lang kasi with this question walang walang indication, walang reason bakit ka na-operahan. But generally speaking, yes, okay. Wala problema. 3 years naman na. Okay? Kung wound healing lang yung problem natin. Number 4 na pala, sorry. Ano po magandang vitamins na kagaya ko? 2 months pa po yung baby, okay? Postpartum, 2 months postpartum. Madali po kasi akong sipunin. Ano pong dapat na vitamins para di madaling mabinat? Okay, number 1 sa sipunin muna. Yung immune system natin, of course, vitamin C is a very good vitamin for you, especially during this time. Okay? Vitamin C, that's number 1. Yung mabinat or in Bisaya, mabughat, wala yan sa amin, no? Sa mga doctors, walang ganon. Perhaps, if you are breastfeeding, take your calcium supplementation, mag-ano ka pa din, mag-ferrous ka pa din. Kasi minsan, pag hindi minsan, if you are iron deficient, yun, medyo matamlay, you look pale, palaging pagod. So para hindi ka maging deficient niyan, you take your ferrous, you take your calcium, especially I think I'm convinced that you might be breastfeeding your baby, okay? And eat well. This time hindi I discourage yung mga diet regimen. For sure when you are breastfeeding, you will lose weight naman na. So because the calories that you burn when you are breastfeeding is several folds more kung nag-diet at nag-exercise ka. So you eat properly for your nutrition and para marami yung milk supply. You drink your vitamin C, calcium, and your ferrous. Okay. Number 5, Doc, sumasakit ang tiyan ko pag mimens. Yung bang dahilan hindi ako mabuntis? Okay. If I understood it correctly, this is dysmenorrhea because there is pain during menses. Okay. If it is dysmenorrhea, then we have two kinds, primary and secondary dysmenorrhea. So if this is the case, okay, if there is no other cause of the primary dysmenorrhea, kung nag-ultrasound na, wala namang problema, primary dysmenorrhea lang ito. We have several management for that, natural management. You can view it if you visit my YouTube channel, Shi TV. I made a video on primary dysmenorrhea, and you can watch how to avoid or how to prevent primary dysmenorrhea. If secondary dysmenorrhea naman, meaning there is a cause kung bakit ka nag-dysmenorrhea. It can be a endometrioma or there is an ovarian mass na puno ng endometrial lining and glands na during your menstruation lumalaki siya. May pelvic endometriosis, masakit, nagkaka-adhesions. Kung ganun siya, yes, it can be a reason why you are having a hard time getting pregnant. So for us to know which of the two, primary ba or secondary dysmenorrhea ba, for us to be able to know which of the two, magpa-ultrasound. Tapos magpaalaga na din sa OB mo. We have we have a short tawag dito. We have a short observation time. If you don't get successful, atras daw ako, sabi, kasi natatamaan yung ulo ko. Okay. We only have a short observation time. Okay? If your age is 35 or less, 1 year na hindi maging successful during trying to conceive, a period of trying to conceive, hindi ka magbuntis after a year, I think you need to seek consultation already. But more if you are 35 years old and above. If after 6 months hindi pa din naging successful, magpatingin na. Again, I also have a video on when to seek help if you are trying to get pregnant. It's also there in my channel, Shi TV. You please visit it. Ang dami matutunan doon. Okay? You will learn a lot when you visit my channel. Okay? Number 6, Number 6, pwede po ba akong mag-take ng emergency contraception ngayon para maagapan yung pagbubuntis? Okay. Actually, the best emergency contraception is levonorgestrel according to our, clinical practice guidelines. But I don't think we have here in the Philippines. So instead, what you give to yourselves are the several pills you take all together, and then after 24 hours you take another one. Yung ganun, Number 1, try to look at where in the cycle are you. Are you in the fertile window? Are you post ovulation already, or are you pre-ovulatory? Because number 1, emergency contraception is not a good contraceptive method. We actually do not advise it. In fact, if you resort to that, you might look into you revisit, you talk with your partner, what is the best spacing method or contraception for you and your partner. If, again, I have been endorsing really, you don't need to be taking anything. It's scientific, it's modern, it's effective, and I have been using it for the past 11 years at hindi naman ako nagkamali. I will help you. I will teach you a more effective contraceptive method to use. Okay? Na no need na to be taking or doing the emergency contraceptive because there is a risk. The mechanism of action kasi of emergency contraception, it thickens mucus, kinakapalan niya yung mucus, para yung sperm, parang it will ang tawag dyan, hindi makalangoy ng maayos si sperm hanggat mamatay na si egg. Ang problema, what if your emergency contraception came late? Na late ka na. At so may baby na. At kung may baby na, and the effect of the emergency contraceptive is to slow down everything. So the fallopian tube motility is also slowed down. Ano mangyayari? Hindi makakaabot si baby sa matres at maging ectopic pregnancy. So ang dami niyang risks. So I don't advise talaga. So my advice is you choose a better contraceptive method. Okay, number 7, from a friend. Okay, nagtitake din po siya ng pills. Naalala lang niya lang na uminom ng pills nung nagkaroon na po siya. Okay, then nagpanic siya at ininom niya lahat ng natira. Bad move daw po ba yun? Okay. Yan ang problem. Kaya pills is not very, anong tawag dito? Safe. Hindi ba safe? Hindi siya masyadong effective, especially for those na busy sa mga things in life. May one experience nga, one patient, doktor, nakalimutan ko talaga because I was changing my bag. Yung pills niya, nasa isang bag niya, tapos nag-change siya ng ibang bag the next day. So nakalimutan niya yung pill niya sa old bag niya. So yun, she forgot. And the moment that you fail to take your pill, okay, when you miss a pill, the chances of you having a breakthrough ovulation is very high. Ano bang breakthrough ovulation? Nakakapangitlog yung ovary. At doon, there is risk for pregnancy. But if in this case, I'm assuming this is a 28 pill pack at ano lang naman yon, ano bang laman nun? Parang may iba naman na sa 28 pack, may 7 doon na pang take mo lang na wala ng hormone. So, walang problema na yon. However, kasi, pag makakalimutin ka, pills is not for you. Do not risk yourself. Ang daming side effects ng pills. Number 1, what if may 10 pang natira doon, so iinumin mo lahat yung 10. Remember, the pills can increase the lapot. It thickens ba? Lumalapot yung blood. So, if you have risk for stroke in the family, hypertension in the family, yung mga ganon, you should be more careful. Okay? You look for a more effective family planning method that best fits you and your partner. Okay, number 8. Doc, unta ko, Doc, if anong gamot po para sa fishy discharge po at bakit dami ko white blood? Hindi nga ako pwede kung walang panty liner. Sana matulungan mo ako, Doc. Okay. Number 1, a whitish discharge is physiologic, meaning it's natural if it occurs only at certain days in your cycle, specifically during the fertile window. In fact, the mucus or the watery white to clear mucus is one sign that you are in your fertile window that yes, pwede kang mabuntis. But kung the entire time of your cycle may ganyan, hindi na yan siya normal at may amoy pa, fishy pa. Galing naman, no? Fishy odor. Okay, may pa fishy odor. So talaga siguro mabaho ito. So if ganon, may tinatawag tayong bacterial vaginosis. What happens with bacterial vaginosis is that the good bacteria went down, the bad bacteria remains, and it's the bad bacteria that causes the imbalance. Okay? The imbalance of the environment of the puerta. Because the lactobacilli or the good bacteria should balance with the bad bacteria para maganda yung relationship nila sa puerta. But if overzealous yung cleaning o hindi ka naglilinis, hindi ka nag-change ang underwear, isang 24 hours, isa lang underwear mo, o yan, nagpa-panty liner ka, isang buong 24 hours, as hindi pa naligo the next day, yun pa din yung panty liner mo. Of course, those are risks or nagiging breeding ground for bacterial infestation. So for us to be able to determine what really is the cause. Kasi pag ganyan lang, so yes, pwede na we will treat it, but best kasi na makita natin talaga yung discharge kasi there are also other discharges that will also present as foul-smelling discharge that may not be just bacterial vaginosis. So it's important that we differentiate the bacterial vaginosis from the other causes. Okay? 9. Almost. Magandang araw po, Doc. Tanong ko po, papaano po mag-PT? Sa umaga ba or kahit anong oras po ba mag-PT? Okay. Well, the best time, the question is the best, ano? The best time is in the morning kasi concentrated siya. Natulog ka at least 8 hours. Kung sleepyhead, 10 hours, nakakoncentrate lang yung ihi mo sa pantog mo while natutulog ka unless nakaihi ka sa bed mo, no? So, yung ihi mo, nasa pantog mo lang for the several hours of sleep. So, concentrated yung HCG. Depende din kasi yan kung mumurahin lang yung, anong tawag ito, preg test kit mo. So, mas okay na concentrated yung ihi na i-collect mo para i-test mo sa preg test kit. But, kung sensitive naman yung test mo, at kung sensitive naman yung test mo, at nag-take ka, ano tawag dito, nag-test ka anytime during the day at positive yun, positive talaga yun. Pero if you are doubtful, Doc, feeling ko talaga buntis ako, pero nung nag-preg test ako, kaninang 3:00 ng hapon, negative. O di, i-repeat mo the next day, sa umaga, early morning, na concentrated yung urine. Para makita talaga natin kung positive ba or negative. O baka naman, masyado pang maaga. Okay, the best, sabi, theoretically, 9 days from the date of ovulation. Pero para sure, para mabilis na tandaan, 2 weeks. Okay? I advise my patient usually 2 weeks para sure naman positive na yan. Pag positive talaga. Okay? Last, number 10. Ito yung mga submitted this week. Doc, tanong ko lang, ilang months po ba? Puva, pwede mag-prenatal. Ava, pwede na mag-prenatal agad-agad. Okay? Pag malaman mong buntis ka na, welcome. Dito ka na, mag-prenatal ka na. Why? Because number 1, it is important to know if hindi ka ba diabetic. We remember we are Filipinos. Yung being a Filipina itself is already a risk for us. It's already a risk factor for us to be diabetic. So, pag first trimester at yung sugar mo is very high, nakaka-poison yan. Poison. Nakaka-poison yan kay baby. Hindi masyadong friendly kay baby pag very high ang sugar. So, may yung folic acid din. It is best. Actually, folic acid is best started 3 months before your pregnancy. Pero pag hindi naman napaghandaan at ngayon buntis ka na, few weeks pa lang, better na mag-prenatal ka na because so you can start your prenatal vitamins already because folic acid prevents neural tube defect. Yung neural tube defect, parang siyang defect sa neural tube. Paano ba explain? Okay. Kunwari, ito ikaw. Paano ba? Yan. Ito ikaw. Ito si husband. Ito yung other half. Sige. Dapat mag-beat yan in the middle. Pag may defect, ganyan, may defect. Tawag dyan, neural tube defect. Napiprevent yan with folic acid. So if folic acid is started pre-conception, hindi ka pa nabuntes, or 3 months, at least 3 months before getting pregnant, until the first trimester, then we are able to maximize the folic acid. Pero pag hindi naman, the soonest that you know that you are pregnant, mag-prenatal ka na agad because you'll be learning a lot. We will be able to prepare more if we start our prenatal early. Okay? Hindi naman kailangang face-to-face agad. Kuwari, ngayon, takot ako, Dok, talaga, ang rate ng Cebu is takot ako nababa sa bahay. Mag-online tayo. Again, we do not just cater on face-to-face consultation or in-clinic consultation. We also have virtual online consultation. Kaya nga ako na namimigay ng free online consultation coupons para wala na talagang rason para hindi makapagpakonsulta. Okay? So, I think I answered all the 10 questions already. Thank you very much for those who submitted. Now, it's time. Okay, we will review. Baka may mamiss ako. I'm really sorry if I missed any of your questions. Please don't feel bad. Ibig sabihin na tabunan. Mag-chat ka ulit. I-chat mo ulit para mabasa ko. Okay. Okay, my question from the audience. Dok, maayong hapon. Akong pangutan na Dok kay ko bagdu ko sa akong bana nganong magsakit man akong puson Dok. Oh, okay. There is pain or dyspareunia ang tawag doon. There is pain during sexual contact. Number one, are there false main discharges during contact? Have you noticed if there is also bleeding after contact? If yes, then you visit the nearest obstetrician gynecologist. We will have to do a speculum exam. We will check if there is something wrong in the cervix. Okay? Or, if wala namang ganon, masakit lang talaga siya. Perhaps, there are adhesions. Ano ba, naoperahan ka pa before or nagdidysmenorrhea ka ba at nagkaka-pelvic endometriosis? One of the signs of pelvic endometriosis is pain in deep penetration. So it's one sign of pelvic endometriosis. So ganon, those are the possibilities for you. Okay? So is another. Hi Doc, afternoon na ako'y pangutana, asawa ni Raymond. Oh, hi! Hi Raymond. Okay. Akong regla dili normal. So hindi normal yung regla. Once tagsara ka adlaw. Okay, just once every time. Though it occurs monthly. Okay, it occurs monthly. Monthly naman yung period, but only once, parang one day lang. Okay, did I get the question correctly? Okay. Number one, how old are you? Okay, it's a important question. If you are already 45 and above, there is what we call a parang perimenopausal stage. If you are at that stage already, then it is expected that there will be changes already in your cycle. But if one day, we need to, pwede din natin, we can also do ultrasound. If you are less than 45 and you are having this, you can also do ultrasound to check what is wrong, if there is hormonal imbalance. Pero kasi, talagang one day lang, wala na talagang, ilang pads ba ito? Okay, so we need to look at if there are other abnormalities kasi ano naman one day parang pwede naman siyang it can occur naman in some, but for us if you are bothered talaga, it's best that we do an ultrasound to check ano ba what's causing why you're only having one day menstruation per month. Okay? 2 years. Okay, she's been like this for 2 years. Okay. 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 Wait lang. Check natin. Natawa ako. Okay. Hello, Uncle. He's my uncle from Bohol. Thank you for being with us this afternoon. Okay. Okay. We have a question also. Okay, let's show it. Doc, good day po. Pwede magtanong, may myoma po ako, nasa ibabaw ng matres, 7 cm na siya, Doc. May gamot pa ba sa myoma? Oh, okay. The myoma is large. Okay? Malaki na, 7 cm. We need to remove it. But, pag hindi naman emergency, kasi we are at pandemic if you're not bleeding, we can wait and discuss it with your OB kung pwede bang ma-delay ng kaunti. Is it bothering you pag masakit? Is it painful? Are you bleeding heavily during menses? If hindi naman siya emergency tanggalin, wag muna kasi pandemic pa ngayon. As much as possible, do not expose yourself in the hospital. But if it's bothering you, you feel the mass effect, parang ano bang mass effect? Pag may natatamaan na, may hindi ka na nakakapagtae ng maayos, masakit na siya, I think you to remove it. Kaya nga itanggalin na. Kasi malaki na yung 7 cm. Tapos, if wala ka pang anak, it can become a problem for you. If malaki talaga. Malaki ang 7 cm. So, I would advise na tanggalin mo. Kasi until now, wala naman talagang medical na management that can effectively dissolve a 7 cm myoma. Masyadong malaki yon. Hi, Jessa and Dylan. Thank you for watching. Okay. Okay, si Carmel Daging. Hi, Carmel. Doc, unsay tambal sa Picos. Carmel, I invite you to subscribe in my YouTube channel, Shi TV. One of the most viewed videos I made is about PCOS. So kindly look at it, um, try to view, try to learn from it. You will learn a lot from my channel actually. And I will also be uploading because I was invited to talk about PCOS, and it would be nice to also share it with you. So I'll be recording it again, and I'll be posting it in YouTube. So watch out for it. But for now, for the meantime, you can visit it in YouTube, Shi TV. It's how to manage PCOS. That's the title of my video. So you can go there. It's very easy to remember. Mabilis lang. It's about PCOS, how to manage. Okay? So, all right. Okay, Manuela, hello. Good PM, Doc. I have Nabothean cyst in my cervix. Na pa ba possible ma-pregnant ko? Thank you, Doc. God bless. Okay, you you are very observant in your ultrasound. Congratulations. You really look into the details. But do not worry, Nabothean cysts are like parang pimples lang in your face. Maliliit lang yan. It's just that ang tawag Nabothean cyst. So, pa nakakatakot pakinggan, ano? Hala, sis. Pwede pa ba ako mabuntis? Do not worry. Para lang yung siyang pimples dito because of the change in the epithelium, may mga ganong-ganong nangyayari. Don't worry about it. Hindi yan makakaano. It's very small, okay? If you want to get pregnant, you also again visit me. Talagang in-endorse ang channel kasi marami na nga akong ginawang video doon that's educational. 3 easy steps to get pregnant. You can view it there so you will know when your fertile window is. Or if you have been trying to get pregnant and was not successful, you also watch when to seek help when you are trying to get pregnant. You also will be able to view it there. Okay? Kaya pa ba? We will, okay, all right. So, sige, kaya pa. Okay. Okay. I'm 41 years old. Wala naman pong symptoms. Normal akong dugo every month. Unya, mga 3 days, normal lang akong ugpidok. Okay. Then, sige, if it's not bothering you, pandemic naman ngayon, we'll give it to you. We just observe it na hindi siya mag-grow. Anyway, when you become, naku, may 9 years pa tayo before menopause eh. So, sige na lang. Okay. For now muna, we just observe it. Let's maximize let's maximize observing muna your myoma because again, if I am your friend and also a doctor, since this is not an emergency case, I would recommend against you being exposed unnecessarily sa hospital because nandun yung mga yung mga medyo symptomatic, grabe-grabe, naka-ICU na may anong tawag dito, COVID. So as much as possible, wag muna. And because when you are post-surgery kasi, you need to have a good immune system then for you to be able to heal. Kasi incision din yan sa abdomen. So, yun. Okay. Manuela, you're welcome. Okay, si Jessa talaga. Okay, Doc, as unda ko, unsaon pag-manage sa dalit mairita. Okay, Jess, you might be very stressed already and you need time to relax and unwind. You've been very hardworking. I have seen your posts. Very, very hardworking. She's doing a lot of businesses already, been cooking. I'm so proud of you. You just need to unwind, you loosen up a little, breathe some fresh air. Again, emotional health is as equally important as physical health. So you go unwind, you enjoy, you should not be guilty of giving time for yourself because you need it. I know you are taking care of Dylan. You've been very caring. Everything you've given it to her, all that she needs. But also you need time for yourself. Do not be guilty on giving that to yourself. You cannot give love if your love tank is running low. If it's running low, you need to fill it up. Okay, you go out with friends, you talk it over. If something is bothering you emotionally, you talk it with somebody that you really trust. You go out, you just unwind. If you don't like to talk, you can just go out and then or you can get angry. Okay, sige, mairiti ka. It's part of how you healthily manage your stress. One reason of stress is if you lack sleep, if uh, your food is not very healthy, it's not very helpful. Okay, that's another one. And lastly, support people, support persons mo. Okay, if you have a good support group, you tell them, I'm really having a hard time managing my emotions. If you can help me, let's go out or let's eat something good. Oh, yung ganon. Because there are studies that when you are able to eat something very good, your mood will improve. Ayun. Okay. I think, okay, you're welcome. Okay, you're welcome. You're welcome. Okay. I think we're able to, or do we have pending questions? Okay, we have no more questions. Once again, oh, it's 10 minutes before 5. Once again, thank you very much for your time this afternoon. For our winners, um, I hope you messaged the page already so we can respond with a coupon for you, for a free online consultation coupon for you. Please, again, do not forget to subscribe in our YouTube channel, Shi TV, or follow us in our official Facebook page, Dr. Shi Armero, OBGYN Lifestyle Clinic. If you wish to have a virtual consultation, an online consultation, our booking assistant will be very glad to assist you. Or if you need an in-clinic consultation, you can also click the book button, or you can send us a private message on the date and the time you wish to visit us, because your safety is our priority. We don't want you to be flooding the clinic, because again, we want you to have as much as possible a scheduled visit with me, so you won't be crowding there at the clinic. As much as I want to take care of you, of course, I want you to be safe on your way to visiting me and while you are visiting me. Okay? So, again, once again, congratulations to our winners. Please visit also, we have our website, Obstetrician Philippines. We have blogs there. I also write some when I had time, but now I barely had time. So I will just record on video. I hope you will learn a lot from my channel. You tell your friends. Next Saturday, okay, next Saturday, I will see you. Thank you once again for being with me this afternoon. Lovies, thank you very much for being with me. I will see you. Bye.